Alrighty, thanks, Bill. May just around the bend, and that will actually mark National Stroke Awareness Month.
Dr. Kenneth Perry from Trident Medical Center is here with us tonight to talk with us about stroke-related ranking high in South Carolina. Now, you have a way that you can kind of identify stroke very quickly. Be fast. What's that about?
So that's basically our acronym that we give the community. We're looking to make sure that they're having the approach. They're looking to see if they're having weakness, or if they're having difficulty speaking, or if an arm is weak, or if there's some sort of difficulty getting words out. There's always, you see if there's asymmetry to their face, meaning one side's not looking the same as the other. We're just hoping to identify stroke as early as possible.
Okay,
That's
and that
the thing.
acronym, I'm sorry to cut you off, that acronym though, FAST?
Right. So that's basically, in the community that we use that for our face, arm, and then whether or not someone's having a difficulty with speech, and then also, of course, if someone's having difficulty with ability to kind of know what time it is.
I see.
To the layperson, what is a stroke when someone has one? What's happening inside their body?
So a stroke can be one of two things. Either way, it's either blood not getting to the part of the brain that's necessary, or if it's blood getting out of the vessels in the brain and causing problems because it's not getting to the place where it's supposed to because of that. It causes a problem with the ability of the rest of the brain to function because you're not getting oxygen there.
Are there any other telltale signs that you might notice before we get to that FAST acronym that might help you get treatment sooner?
That is what is so difficult about stroke. Until it happens, you really could be sitting on a time bomb and not know it. That's why we always hope that people get to their primary care doctor as often as possible and get some of the screenings that we were talking about. Okay,
and speaking of those screenings, there's a couple happening later this week at Trident. Tell us about them.
Well, one of the things that patients need to know is whether or not there's a really high plaque burden, meaning there's a lot of that really sticky plaque in their arteries. And we have a screening coming this week, and you're going to be able to get an ultrasound of the carotid arteries, which are the arteries in the neck, which is one of the major concerns and major risk factors leading towards strokes.
All right, now you've brought your doctor gear here. Let's
oh yeah, we can
check Lisa out while we're talking here about stroke. I'm sure pretty sure people out there have some questions about what they need to be looking out for and how big of a problem this is here in South Carolina.
So South Carolina, the biggest problem is they really have a lot of medical problems. And these medical problems together really end up being a concern, because if they don't have primary care doctors, it's going to be a major issue for them.
And he's trying to read her pressure. So
once again, very low. So you're actually clean bill of health on this one.
That's good. And I get a little nervous on TV too when I do my job.
The white coat syndrome is what they call it. Well, doctor, thank you very much for joining us.
Thank you.
And there's some information on your screen about those free screenings. Take advantage of them and make sure that you know how you're doing.